Dialogue with a Doctor, featuring one of Southwest Florida's leading gastroenterologists, Dr. Raymond Phillips of Gastroenterology Group of Naples.
Welcome to the show. Dr. Phillips, just tell us a little bit about yourself and your practice.
Well, absolutely, Jim. Thanks for having me back again. I enjoy being with you. And as far as my practice, I'm a gastroenterologist.
That's right.
And what a gastroenterologist is, I practice with other gastroenterologists, and we deal with digestive disorders. You know, that is to say, problems related to the upper as well as lower GI tract. And oftentimes we'll do examinations like endoscopies, upper endoscopies, or colonoscopies to evaluate people. But we also deal with liver issues. And to get to that point as a gastroenterologist, there's a lot of training. I went to college at Princeton, went to medical school in St. Louis at Washington University, did my internal medicine at Jefferson Hospital in Philadelphia, was chief resident. That was 4 years of doing that. And then since I'd gone through college on an ROTC scholarship, I went on active duty and practiced as an internist for 2 years. And then I was selected for gastroenterology training at Walter Reed. And I was there for 2 years and then on staff for 2 years. But the point of stating all that is a gastroenterologist undergoes, many years of training before they're the point that they're practicing and dealing with gastrointestinal issues. And so when you're dealing with a gastroenterologist, you're dealing with whom is very, very specialized in this particular area of medicine. And so, from a practical sense, we deal with very practical issues. And we've talked about a number of issues in the past, and you'd mentioned you're interested in a particular area this time, and we were discussing earlier about heartburn and issues related to that.
Yeah, acid reflux, GERD. Then we're talking about the proton
pump inhibitors. Right.
What are the pros and cons of that?
Yeah, absolutely. First, the gastroesophageal reflux, that's the formal name for that circumstance where stomach contents, instead of remaining in the stomach, flow upwards into the esophagus. And when there's acid in that fluid, it can give you a burning quality in your upper abdomen, your chest, or even into your throat. And for years, the traditional treatment had been to use medications that neutralize acid.
That's right.
Yeah, like years ago it was baking soda, then antacids like Maalox, Mylanta. And then in the 1970s, the first production of a medication called Tagamet, and then subsequently Zantac in 1980, allowed prolonged reduction of acid production. So for a period beyond just 5 or 10 minutes, providing relief for beyond just a few minutes, by reducing acid production, you can get relief for up to 2 or 3 hours. The troublesome thing is that acid production in the stomach is constant, and then as a consequence of meals, you'll promote even more reflux.
Right.
Of course, there's a lot of other things that promote reflux in terms of particular foods, rich foods, foods that like chocolates, mints, alcohol. But there's other items in terms of timing of meals, eating late at night, lying down after a meal. Those things all can promote reflux, and then if you're heavier and you're carrying around extra weight, that puts pressure on the stomach and promotes reflux. So all these things together collectively can lead to a circumstance where there's acid flowing up to the esophagus. But so in conjunction with medicines like Zantac, Tagamet, we would do lifestyle interventions like losing weight and watching what you eat, but still we weren't getting enough improvement. So in 1990, the Prilosec was released and approved by the FDA, and it really marked a revolution in the care of people with reflux disease. Now we could give prolonged improvement in acid reflux up to 24 hours with using these medications. And that was really exciting, and we were the uniformity of effectiveness was such that many people for the first time in years didn't have to suffer with heartburn. Subsequent other medications similar to Prilosec became available: Nexium, Dexilant, Prevacid, Acifex. And all these drugs share a similar property of being able to profoundly reduce acid production over a 24-hour period. Now, inevitably, I get someone who remembers their high school biology and says, well, isn't that acid there for something? Yes, indeed. The acid that's present within your stomach, it does help the digestive process, but its principal purpose is to actually sterilize food. There was a time not too long ago where you picked up food off the ground and you ate it, so there's a lot of bacteria in it. So the acid was serving a purpose, but it's not so relevant right now. So these drugs, Prilosec, the prototype among them, became really widespread and widely used. And however, in the last 15 years, there's been some reports of potential complications associated with these drugs. And initially, their concern was that because of the profound reduction of acid production, that it might alter the absorption of certain nutrients. And calcium was looked at, and there was preliminary reports indicating that these drugs might diminish calcium absorption or the incorporation of calcium into the bones and lead to a diminished bone density called osteoporosis. And in more detailed studies have not really validated those concerns as much, but it was a concern. But subsequent to that report, over the last 10 years, there's been more and more reports of other potential side effects that have been reported. Since it affects acid production, and acid production is related to B12 absorption, there was concerns about diminished absorption of B12. And that is not so clear-cut. There seems to be indication that's the case. There's a rare person that can lose magnesium as a result of proton pump inhibitors. But the things in the last few years that have gotten a great deal of attention is that the indication in large population studies that these drugs might make individuals more susceptible to Alzheimer's disease. Now, that was reported out in Germany 2 years ago, and subsequent reports didn't validate that. But still, there is that lingering concern. There was reports about diminished kidney function as a consequence of these drugs. There's also a concern about issues related to a higher incidence of coronary artery disease or heart attacks. These are sort of those particular side effects that have been reported. The risk is very low, and subsequent studies really haven't fully validated those concerns. The one area that proton pump inhibitors really truly make a difference is making individuals a little more susceptible to certain infections. So there's a slightly higher incidence of upper respiratory infections and pneumonia in particular. And the other one that's an issue, and we've talked about this before in other shows, is that there's a higher risk of a particular infection, a gastrointestinal infection called Clostridia difficile. Mm-hmm. And Clostridia difficile is one that can give you a gastrointestinal inflammation of in particular of the colon, colitis, that can give you diarrhea. And it can be an infection that can be very, very stubborn at times. So collectively, a number of different potential side effects, but in aggregate, when each of these have been looked at in close detail, the risk is relatively low of any one of these things occurring. And many of them, such as Alzheimer's disease, issues in terms of osteoporosis, aren't really valid. But as a consequence of these concerns, now a number of patients who never had heartburn for years are now stopping their medications and suffering and experiencing a great deal of acid reflux, which is not trivial. When you're having acid reflux and you're having heartburn, it is very, very uncomfortable. It can lead to substantial problems in itself, in that it can cause a burn of the esophagus and lead to scar tissue and problems with scarring of the esophagus and difficulty with swallowing. And unrelieved reflux can sometimes cause enough injury to the esophagus that you might be more susceptible to cancer of the esophagus. So there's a role for these drugs, proton pump inhibitors, and if truly an individual has symptoms and they're persistent symptoms and they're not controlled with lifestyle interventions like we talked about, and not controlled with simple antacids periodically, yeah, it's reasonable to consider using these drugs. But all these concerns about side effects underscore that, hey, you really need to use the least dose possible that's still effective, and recognizing that some individuals really do need the medication, and it's safe to use when used by a gastroenterologist and with the counseling of a gastroenterologist. Now inevitably people say, gosh, do I have to take a medicine? And yeah, there's other things that can be done in terms of operations as an alternative, but that's a whole nother show practically, talking about how to do operations to
But
prevent
people
reflux.
that are having cancer treatments or have had a transplant or something wouldn't be able to take these kind of medicines,
Well,
right?
these drugs are safe, even
They
in
are.
that context. Individuals who've had liver transplants or other major transplantation, they have a lot of medical problems, and these drugs are important to use, and they're safe to use. There is a potential concern about interaction with other medications. And when you get individuals with other medical problems, inevitably they take a lot of other medications. But the interactions are relatively rare, and it's easily checked and cross-referenced with other medications. So the point being, yeah, there's a role for it. In the United States, there's the industry is huge in terms of the need for different types of medications for reflux. I believe right now it's a $10 billion industry per year in terms of the, so it really is quite a medical problem across the United States. So the issue of potential side effects, it's a legitimate concern with any medications, but it wouldn't prevent the usage of these medications if you truly have symptoms that warrant that.
Well, Dr. Phillips, I appreciate you coming on the show, and I really think our viewers have learned a lot today, and I hope you come back again.
All right, thanks so much,
Thank
Jim.
you.
I appreciate it.
Are you in need of a gastroenterologist in the Naples, Marco Island, or Bonita Springs area? Dr. Raymond Phillips of Gastroenterology Group of Naples, along with his fellow physician associates, are board certified in gastroenterology hepatology and one of the most respected medical practices in Southwest Florida. Hear it from one of his patients directly.
I've been a patient of Dr. Phillips for myself personally the last 20-25 years. He's treated my family, my extended family, my friends. I never mind coming here because it's a very friendly place, and everyone here makes me feel that way. They're so caring. And Dr. Phillips, I get a chuckle out of him because everywhere in his building it says, "We work where the sun don't shine."
With the medical industry changing so rapidly, Dr. Raymond Phillips offers the newest technology and treatments in his field. If you are looking for a practice that is attentive and will address all your questions and concerns, call Dr. Phillips' Naples office today for an appointment at 239-649-1186.